Thank you for joining me today, Megan. First of all, are you able to just say where you work and what your role in the workplace is?
Yep, I work at Kedron Kmart Pharmacy. I'm employed as a student pharmacist. I'm in my third year of pharmacy currently.
Okay, and so obviously you work in the pharmacy itself. Is there any other aspects that you also deal with?
Yeah, so often I'm in the dispensary doing some dispensing, or I'm counselling customers, or I'm out on deliveries with the scripts for our elderly patients that can't make it into the pharmacy.
Okay. And so in terms of communication, what would you say are important skills that you must have both in the pharmacy and outside so that effective communication is achieved?
You've got to be able to differentiate it between each customer. So on deliveries we have our regulars, and for each customer they require a different type of communication. So we've got people with dementia, people with hearing problems, people who don't speak English as their first language. So you've got to be able to adapt and get the information across regarding the prescription so that they're taking it effectively and taking it safely. Whereas in the pharmacy, generally, because then they're not as elderly or they're out in society, it's easier to communicate with them, so you're more counselling.
Okay, yeah, and I also work in a pharmacy and I do delivery, so I can understand that when you have a variety of clients, that you do need to change the way that you communicate with them so that you can build rapport with them and become friendly, talk to them for a little while, and just make them happy.
That's it.
So when you are with clients and out on delivering, what would you say are the most essential communication skills that you wouldn't see so much in the pharmacy itself?
Well, most of our delivery patients, as I said before, they're our regulars, so we build a sort of a relationship with them. So I know lots of them, so asking them about their day, that sort of stuff, because often we're the only people that come to see them. Often they're living by themselves, so you've got to make it worth their while for you to go visit them.
Okay, yeah, so you really want to make them feel like someone's there that they can talk to.
That's it.
Sort of like having a second family.
Yeah, you go and you can have a cup of tea with them, because sometimes you're the only person they see. So it's not more about the counselling on the prescription side, it's more developing that relationship with them and making sure that they feel welcome at the pharmacy.
Yeah, okay. And also when you're out on delivering, if there is a communication barrier, or you think that your communication hasn't been effective enough, how do you go about dealing with that, and what skills can you use for that?
A lot of our patients are using dosage administration devices such as Webster packs, so it's not so much about getting the information across about the medicine, it's about billing, that sort of stuff. So you've got you write it down if they're hearing impaired, or if they've got disabilities such as dementia and that sort of stuff, you write it down, or you explain it in layman's terms. You're not using complicated names. You're saying the white pill instead of Perindopril or something like that. And we've got a few customers where English isn't their first language, so you try and break it down. Try and even reduce your accent as much as possible, which I know sounds a bit silly, but sometimes it's the accent that troubles them more than the words.
Okay, yeah, so more the fact of the effective communication can also be like in the form of writing. It doesn't actually have to be vocal.
Yep, you can use hand gestures, two instead of saying two, that sort of thing.
Okay.
Because sometimes for some of the customers it's quite difficult, especially if they're not used to English or they've got certain things that make communication difficult anyway.
Yeah, sure. So obviously you've got the delivery aspect of your job.
Yeah.
You also work in the pharmacy itself, and you'd be dealing with clients coming in as well as your colleagues.
Yes.
So probably first off, how does your communication differ between your colleagues?
With the pharmacist, if I'm conversing with them about a prescription, I'll be using drug names, that sort of stuff, because they've studied that and they know what I'm talking about. Using our abbreviations for scripts, that sort of stuff, saying PRN instead of run required. Whereas if I'm talking to the retail manager, she hasn't got a pharmacy background, so it's explaining not using that professional knowledge because she doesn't have it.
Okay, yeah, so more realising when to use appropriate communication.
Yeah, depending on who you're talking to.
Yeah, so can lead to the effective communication and so there's no breakdown in any of the information that's passed on and ultimately you're not harming a patient.
Yes.
Okay.
Yes.